And welcome back. It's so good to have everybody with us today. I have a very special guest with me. He shares the last name with me, Berman. His name is Scott Berman. And to my knowledge, we are not related. We have not done a DNA test or Ancestry.com to see if we could be related. But I met Scott a good number of years ago when we first got into the cannabis business. And we were attracted to each other immediately because he also has a pharmaceutical background. And that was what attracted us to each other, because we saw many, many years ago that there's going to be a convergence in cannabis and pharma. And we see that convergence finally happening now. We see that convergence happening with the acquisition of Pfizer buying Arena Pharmaceutical for $6.7 billion. So I thought it would be appropriate to have Scott on our show today to talk about his background in digital marketing in pharmaceutical and health and life sciences, because we believe that all the lessons we've learned in pharma and life sciences in our side of the world in cannabis BPO, which means reaching out to doctors and educating patients and engaging with patients and all that stuff that we do on the phone, chat, mail, email, Scott, in his background in digital, does that non-personal. We refer to that in pharma language as NPP, or non-personal promotions. So I thought we'd have Scott on to talk about his background in pharma marketing and digital marketing, to talk about how we can take some of those lessons and apply them to the cannabis space as well, because there's great lessons to be learned. Everybody knows that pharma knows how to have that patient journey experience better than anybody. And so I think those lessons are something that we can all take away, whether you're in pharma or not. But Scott, welcome to our show, and take a few minutes and just give us a background, your pharma background, in terms of digital marketing and some of the neat accomplishments you've had over the years.
Sure. Thank you, Mr. Berman. It's a pleasure. And I'm sure we are related back in our
somewhere we must be.
It's great to be with you today. Thanks for having me. So yeah, I've been involved in the healthcare digital marketing for many years. Basically what we did at my previous companies, we took offline data, HIPAA compliant data on ailment and prescriptions, and we matched that up to cookies, device IDs, and cable boxes. So we had addressable healthcare advertising. We worked with hospitals. We drove traffic to Obamacare in the early days when that came out. We did clinical trial recruitment. We worked for pharmacies and pharma companies, urgent care centers, and it was all based on a very specific data-driven approach. So we took a look at what people were taking in terms of medications, and then we tried to get them on to something different. And so along this line, I started getting very interested in the cannabis space. And one of the first things that I did was I made a list of every medical condition that was a legally approved condition for that particular state. So I went in those days, there was maybe 20 states. And so I just made a big list, and then I compared it with the data that we had on the ailments. And I looked for the overlaps. So Crohn's disease was one of them. So I would look for a state. Most states would approve Crohn's for medical marijuana. We had data on Crohn's for pharma companies. So I went to the cannabis conferences, and I told anybody that would listen that if you want to sell medical marijuana to patients, do it in a very specific level. It was a little early for that, but I think the time has come where it's a lot more important now.
It's all about targeting. That's my takeaway on digital, my experience working and collaborating with many digital providers over the years in pharma. It's all about narrowing that net down to a really narrow geographic as well. Help us understand how highly targeted these campaigns can be.
Yeah, it's really amazing. And first of all, geographic is important. So zip code targeting, that's one thing. So we take it down to the zip code level. Age, gender, income level, likes and dislikes. So people are put into buckets based on their cookies and their device IDs. And then they're grouped in categories. So we have a male who has this disease and is taking this medication. Then we know that when we have a client that wants to advertise to this person, we use that cookie pool. And we do that across dozens and dozens of different ailments. And so then the other thing that we do also is a lot of lookalike targeting. So we start off with an audience, we start to serve them ads, we drive them into a website, and we collected data on the website on who's buying and who's converting. And then we start to refine the audiences to get them smaller and more targeted over time.
Highly effective, highly targeted. One of the things that comes up that I think about, and we've talked about ourselves, is the issue of privacy. One of the things is, do you disable cookies? Is there really privacy? Help us understand the issue of privacy, and should we be concerned as consumers? Is it creepy, some of this stuff?
Well, you know what? I don't like the word creepy, but yeah, it can get, first of all, it's a very big subject, and I'll try and keep it short here, but the idea that there's no personally identifiable information. So when a cookie, when we put a cookie into a bucket, there's no PII involved. And so we know that it's a male, we know age, and we know zip code, but we don't know name or address. That's stripped out. Okay, so that's number one. With the healthcare, it's all HIPAA compliant, the data that we use. That's number two. Number three is that we actually anonymize the data before we target it. So it's totally blinded. And also the final point, which is really important, is that it's usually most often opt-in. So a patient will go onto a website, they'll fill out a survey and say, myself or my loved one is on this medication for this particular illness, and they check a box that says, I would like more information on that. Once they opt in, then the privacy is not as a factor anymore. What we don't want to do is serve ads to people who don't opt in.
Got it. Yeah. So it's all about opt-in. Okay. Got it.
It's all about opt-in and HIPAA compliance. Yeah.
To help us understand, a little bit more transitioning to cannabis and how we can take some of the lessons from pharma and apply them to cannabis. Give us a use case. You gave us one at the beginning of our conversation, but give us another use case in terms of how do you target, let's say I'm a brand, a cannabis brand, a well-known cannabis brand, multi-state, I'm in a half dozen states. How do I target someone for my brand based on the customers or patients I'm looking for? Help me understand how that works.
Yeah, the interesting thing about the development of cannabis products is a lot of these folks are making stuff specifically for an illness or an ailment. So let's take sleep, for example, because that's a big one. So, if a medical marijuana company says, I've made this great, the terpenes are really important. We've done a bunch of research, and this particular strain is really good to help people sleep. And it's much better than Ambien or Xanax for sleep. So what we do then is we start targeting people that are interested in sleep remedies or have sleep issues. We target them with contextual advertising when they're reading a blog about sleep problems. And we also look at their cookies and their device IDs. And we start to serve them an ad and say, look, if you have sleep problems, click here to learn more about, our medicine and what we do. It's really key to have backup information, a good landing page with the right in research and information on why it works for sleep. And then we drive them into a local store that carries that product. So that's where the zip code targeting comes in. We don't want to advertise this product where people can't get it because we can't ship it off of a website. So there has to be a local dispensary that actually has it. In the case of a cannabis medicine, and then we can sort of refine it by the zip codes that are really reporting well.
Interesting. One of the things that I love about digital, it's highly trackable. You can really know how well your campaigns are doing. So you're not throwing money at a billboard or a TV or radio advertisement like traditional advertising and waiting 2-3 months to find out if it worked. It's really trackable like immediately, right?
It is. And that's one of the reasons why we were successful in the healthcare space. This was 6 or 7 years ago, because we were able to drastically reduce the cost to advertise to consumers because they were used to buying TV and billboards. So the first thing there's two things that are really important. First is the tracking codes that we put on the website. So we put retargeting codes and conversion tracking codes onto an action. So if someone clicks here for more information, we capture that. If someone buys something, we capture that. And so that's really important. The second thing we do is really optimizing the campaign every single day. So the great thing about this type of marketing is you can stop it, start it, you can add budget to it, you can change the color of the ad. The red ad is working better than the blue ad. You can change the audiences. So typically what we like to do is test different line items. We'll have a male, that suffers this ailment, a female that suffers that ailment, and we'll test them against each other and we'll see which is getting the most clicks and the most conversions. And then the next day we'll put more money onto what's working. So over time, and if you commit, one of the key things in this whole activity is to commit to a couple months.
Right.
If you're running this for a couple months time, the machine learns a lot. So it's some art and some science. And so we as analysts can learn a lot from the data, but also the algorithms, as we know, the algorithms are really great these days. And so they understand who's clicking and they serve more ads to those audiences.
Right. I want to shift gears a second just because of we are talking about the convergence of pharma and cannabis. And we're kind of weaving our way through the patient journey, patient experience, how digital marketing applies. I'm going to switch gears and go to the professional side, which is physicians. And one of the things we've talked about a lot is clinical adoption and how do we get doctors, physicians, and medical professionals engaged in cannabis. There are 1.5 million prescribers in the United States. That's nurse practitioners, doctors, and anybody that has a MD by their name or a DO by their name that can write a prescription. That doesn't include chiropractors, massage therapists, all the alternative. That's another couple million probably off to the side. But the 1.5 million that pharma has focused on to basically get doctors to write a prescription for a certain brand. Help us understand the professional side, how you think digital can play a role in clinical adoption of the cannabis markets.
Well, the first thing is you should hire Cannabis BPO for sure, because these guys have been doing it for 25 years and they have the method. But what I'm really interested in is combining the data-driven marketing with the great work that you guys do. So first of all, targeting the doctors by NPI number and specialty, that's really important. Finding them on apps and blogs that they read and getting them the education information. That's really key, is educating the doctors on why this medicine is better than something that they've been prescribing for years. And so I think there's, we're still at the beginning stages of educating healthcare professionals on the wonderful qualities of CBD and cannabis and really understanding what patient they would work well for. When a doctor prescribes a pharma drug, they probably have a lot of research that this is who it's good for and this is how much the dosage is and so on. We need to get to that point with doctors that we educate them on how this medicine works and who it works best for and what are the outcomes. And so once we have more data on the outcomes, then the doctor can prescribe it more, they can hand out more samples. So we have to get in front of these doctors to let them know about it and then really get them the product to try, because the ultimate thing is the patient journey, as you mentioned, is like I gave this sample to my patient, the patient had a great outcome, I'm going to give it to all the other patients that come in. So I think that's the way to do it. Now, what I like to do is combine the marketing to the healthcare professionals with the consumer marketing. And really, so the consumer is asking the doctor about it and the doctor has the information. And so then it really combines to really build the awareness.
Well, that's kind of one of the things we've been talking about. I like to say that traditional pharma spends billions of dollars a year, hundreds of millions, billions of dollars a year on DTC, direct-to-consumer advertising, to get you to ask your doctor about Skyrizi, Enbrel, fill in the blank. Mostly the biologics because they're very, very expensive. So broadcast advertising is worthwhile. I like to say cannabis is kind of from the roots up. It's really driven by the consumer because patients are coming to physicians and saying, my friend told me about cannabis or my brother told me about cannabis. What do you think, doctor? And the doctor is like, I don't know. They don't know. They have zero knowledge base. And so they basically go like this. No, I'm not interested in talking about it. And so we've determined very early on that education has to be the cornerstone of getting doctors to adopt these. And so using digital strategies is what attracted us to you and your team and your methodology to try and get doctors to come in, because any brand that owns that doctor through education is going to own that physician forever. Yes. The example is Metamucil. I turned 50. I went to go get my colonoscopy, and the doctor said, you need more fiber in your diet. I want you to take Metamucil. He gave me a bunch of sample packs. He didn't say psyllium husk. He didn't say the CVS brand. He said Metamucil. There was a methodology behind it. He didn't just say that by happenstance. He did it because Metamucil invested a lot of money in educating that doctor. So now I'm doing too much talking for this interview, but I'm going to pass to you. What do you think?
Well, my doctor said the same thing to me about Metamucil around the same time, right after my colonoscopy. So I'm with you, Dan. But yeah, no, I think the key is first is education for sure, because you and I have discussed this. We're way behind in this country in terms of the research on these products. We know that places like Israel, they're coming out with, they've been doing this for 50 years and there's clinical trials and so on. So, I don't blame the doctors on the one hand because they haven't had the knowledge base and the testing that they've needed and that they have on every other pharma drug. Now, recently, 2 weeks ago, I think the president signed a medical research bill, which is a huge development. I mean, it's going to take some time, but I think we're going to get there where we find out that, yes, this medicine works really well and works much better and is safer than traditional pharma. So I think the lines are coming together. And, I kind of use this analogy of aspirin came from tree bark. And so, someday a long time ago, someone said, I think we can make medicine out of this. And it was probably a crazy idea in the beginning, and now it's in every drugstore. And so I think we're getting to that point now where the doctors just need to know that the patient outcomes are good. And then they will, be more than happy to prescribe it because it's safer and it works better. So it's just, we have to get that research to the doctors and the education and the patient outcomes. And I think that one thing that's really a positive development is the legalization of cannabis in many different states has provided much easier access, and the stigma is going away. So for a long time, the doctor said no because it was illegal. Now, all of a sudden, it's legal, and the customer can go down the street just like they can go to the pharmacy. They can go down to the dispensary down at the corner and get the medicine for their sleep problems. And so I think the legality of it has provided the patients much bigger addressable market for patients. And so it follows that if the doctors start getting interested in it, then there's a big opportunity for patient growth.
Well, I couldn't agree more. One of the things that drives me crazy about physician and pharma is, obviously Hippocratic Oath is the first is do no harm.
Yeah.
So many drugs that they are prescribing that do harm, including, as we know, opioids, and our opioid story, and drugs like depressants like Xanax and Klonopin and Valium that do a lot of harm over a long period of time. So I think the education and trying to engage physicians and teaching them about this one aspect of the drug, I think, is kind of my personal journey. Is how do we teach physicians this drug is probably falls in the category of do no harm more than most that you ever come across.
Yes.
How do we get the word out there digitally?
Well, it's first of all, it's the messaging has to be strong, and the backup research has to be good. So that's number one. But we also just need to really just advertise. This is where, having some budgets and, back to your earlier point, it's a lot less money than traditional pharma. Like pharma spends millions of dollars educating consumers and running TV commercials. With digital marketing, with a lot less money, maybe $10,000, $20,000 a month, you can get started in marketing your products to different patients and doctors. And so I think that big pharma is going to say, that's nothing. Let's try it. Let's put some money behind this. Let's, like you mentioned, the Pfizer acquisition, they paid $6 billion for that company, right? It's not even, really out yet. So how do we siphon off some budget to really educate people? I think we're going to have excellent results. It's already started to happen, and it's only going to accelerate. I think it's a trend. I think we're going to look back at this time and, 10 years from now and say, man, CBD and cannabis have really grown into the pharma space in a big and important way.
It's going to look different. I think the convergence of pharma and cannabis, I think the early stages it's a whole plant product. Eventually it will be a synthesized product in a pill form, just like people are used to getting from a pharmacy. But in the meantime, it's kind of what I refer to as open source medicine. You get a doctor recommendation. If you're in a medical state, doctor writes a recommendation. You go to the dispensary, which is like one of these salad bars, and they say, over there's the soup, there's the sushi, there's the salad, there's the desserts. Why don't you start with the soup and come back and let me know how you feel? Which is totally opposite of how traditional medicine is practiced, where the doctor writes a prescription. And if you don't fill it exactly as he prescribed, you don't take it as exactly as prescribed, you're considered non-compliant. So it's a very different approach to practicing medicine, which most doctors, most physicians and professionals aren't used to. Yeah. And what it does, though, is when physicians do get into that mode, they find that they have a deeper, more meaningful medical relationship with their consumers because they're actually talking to the patients.
Yeah.
So that to me is probably one of the more exciting aspects of cannabis education and engaging with physicians in the space. But that's my personal goal is how do we get physicians to understand that this is a whole new category that they have to get educated on.
It's really important, actually. And I think that the physician acceptance of this medicine is really going to drive, patient outcomes. And the problem that we've had in this country is it's been an illegal medicine for so long. And I think about seniors a lot because they, when they were, marijuana was like no go for a long time. Now they have ailments and they're on 6 different medications. And we know that cannabis and CBD can replace some of those. So, but they won't do it unless their doctor tells them. And that's a really big issue. And what I've seen also in states that have had cannabis legalized for longer periods of time, the acceptance goes up over time. So California's had medical cannabis for 20 some years. And so a lot of people out there are treating cancer and all these other things with cannabis as medicine. But then you come to other states that don't have anything and people are still like, I don't know, I haven't heard anything from my doctor. So I think that we need to get the legalization going more. We need to certainly the government helping out, like just the fact that they legalize medical research is a sign that things are changing. It's unfortunate that we lost a lot of years here, but I think the future is going to prove that this stuff works. We know, as you mentioned, in other countries, they've been studying this for a long time and the results are phenomenal. So we know that it works. We just have to get to that stage here. We have to invest in it more.
Yeah, agreed. And as we see, we're going to see so many different form factors and ways to take it. But when it starts to look and feel like pharma, it's going to morph dramatically. You're going to have the equivalent of OTC, over-the-counter cannabis that you can get at a regular dispensary. You're going to have prescription cannabis that you get from a doctor for a very specific disease state that's probably synthesized. So it's a very different approach.
It's exciting. I actually, personal story, my mom is taking RSO pills. She's a cancer survivor. I got her into Rick Simpson oil years ago, and now she's called me the other day. She said, my dispensary's out of Rick Simpson oil pills. Can you find some in your neighborhood? And it's like, that's someone who, for a long time, no go. And now she's convinced. And so I think we have this opportunity because it's, comes in a pill form. It doesn't have to be smoked. Then it become a lot easier for people to take it, just like they're taking their Tylenol.
Yeah, and to manage the impairment aspects of it, I think is also key, especially for elder. And I think that you're going to see a lot of the ratioed products out there do exactly that, to give you the medicine without the impairment.
Yes.
I like to say that getting high is a side effect or an intended effect. It really depends on the patient.
Right.
Right. Some people like that effect because that is part of the medicinal journey, to relax and feel high. And some people they don't like it and they try and avoid it, but there's ways to do that. There's all kinds of formulations to do that, which is exciting.
It's really exciting. And then there's tinctures and there's lozenges and there's a lot of different ways to consume it. There's patches for pain. You put a cannabis patch on your back if you have back pain. And so I think it's really interesting. And also, as we discussed earlier, the formulations are becoming very specific. So we're getting better at refining the plant and the terpenes for a very specific effect. And there's so many different options, and there's a lot of money being poured into this part of the industry to develop very specific strains that deal with ailments. And that's really exciting too, because most people don't know, they know sativa and indica, but there's a lot of varieties in there that are good for different things based on how they're formulated.
Well, there's literally thousands of different cannabinoids we're discovering every day.
Yeah.
And terpene combinations that have different effects, and different extraction techniques have different effects. That was my aha moment when I went to Israel and looked at all the research that's been going on for well over 50 years. Raphael Mechoulam discovered the THC molecule the year I was born, 1961.
Wow.
It's not like it's new. Right. It's only new to us in the United States in the form we're talking about in terms of medicine. Right. So, listen, Scott, I could talk to you, brother, all day long. We always have a great time chatting, but I want to thank you so much for coming on and chatting with us about this convergence of medical, marijuana, pharma, and specifically digital. How do we take advantage of this opportunity in history to see our industry grow in North America from $26 to $55 billion? I think the key is digital marketing, key engagement with consumers, patients, and practitioners, doctors. And that's why I'm so excited about collaborating with you and your team. And thank you so much for joining us today.
Dan, this has been a pleasure. Thanks very much. I appreciate learning from you about all this too. Thank you.
It's always a pleasure. Great. Take care, Scott.
All right. Bye-bye.